July 5th, the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes, maternity services. Have you chosen your family doctor?
Mavis, would it be a bit rude to ask how old you are?
Yes, it would.
Mavis, would I be right in thinking that you're around the same age as the National Health Service?
Yes, you would. I'm in my late 60s.
And were you aware as a girl growing up in Manchester that you were the first generation being raised under the NHS?
No, I wasn't aware, but my mother must have been, because if I'd have been born a couple of years earlier, my mother would have had to pay for everything. I didn't know about the NHS, but it could be the reason I'm still here.
Having a baby does make you appreciate the NHS and the healthcare you get from it. I mean, who wouldn't want to give their baby their injections against measles and whooping cough? It's made me think about so much more than just their health, like the polluted air that we all breathe. Should I take the bus or the public transport instead of taking the car? We just used to zip around and not think about it, but I'm concerned about so much more than just their health.
Zoe's right. We all want to live better. And there's so much more that we can do ourselves to make sure we and our families lead a happy, healthy life. We're lucky that our city has plenty on offer to help us be more active, eat healthier and get out and enjoy life. David Regan is in charge of Manchester's public health.
80% of what will make Manchester healthier isn't medical. That's why the NHS and public services and the voluntary sector are now working more together on the things that make and keep you well. Looking after yourself in pregnancy, eating well, keeping active, having fun with your kids and grandkids, looking after your mental health, working or volunteering, believing that age is just a number, keeping your mind and body active, making the most of age-friendly Manchester, our libraries, galleries, schools and health centres, and using our support to stay well. And really important, going to those screenings and health checks. That's what our Healthier Manchester is all about.
So that's the plan. And to support us to get better at staying well, the health system in Manchester is making the biggest changes in its 70-year history by forming local teams of GPs, mental health coaches, social workers, community nurses, pharmacists and physios, working together in our local neighbourhoods to support us to get better at staying well. These groups of healthcare supporters now work as a single local care organisation whose job is making sure we get support close to home and out of hospital where possible. And they're boosted by strong voluntary organisations like Citizens Advice, who now have a hotline inside this health centre.
Patients sometimes come to see us with problems, or maybe a whole host of problems, part of which I can't help them with. And previously we've had to say, go somewhere else. Now all I have to do is say, actually, there's a phone line in reception which connects you directly through Citizens Advice. Someone will speak to you immediately and they can get help straight away.
There's another big change for the NHS at 70. Hospitals in Manchester are joining up as a single organisation so everyone can access the best expertise and equipment across the whole city, wherever we live, just like Mavis did.
The chest nurse referred me to the mobile unit on Tesco car park in Gorton. There I was given a chest x-ray, then I went to see a consultant at Manchester Royal. He made the decision that I did have to go in, and it was diagnosed as cancer. So I went in hospital, in Wythenshawe Hospital, and had a third of my lung removed, top right hand side, and I was free of it after that.
Mavis and Zoe and her baby are living proof that people are what make a difference to the success of health and care services in Manchester. People who go for screenings, mums who breastfeed and vaccinate their baby. It's never too late to make small changes that can make a big difference. So, as our health services change to make themselves fitter for the next 70 years, let's take up the support they're offering to make us and our loved ones fitter too, for the rest of our years.